Hello, this is the PPE and Ebola response plan training for Fauquier County Department of Fire Rescue and Emergency Management. In this training, we're going to talk about the updates to the CDC's interim guidance for EMS providers when it comes to PPE and the way you treat these Ebola patients or suspected Ebola patients. We're going to talk about the guide to proper PPE for dealing with suspected Ebola patients, proper donning and doffing of that PPE, and the Fauquier County Ebola response plan. Okay, so first we're going to touch on these CDC interim guidance for EMS personnel. This is an update from the previous training that as a DFRIM provider was on ePro. As a volunteer provider, you access this through the EMS committee webpage. The temperatures have changed. We assess our patients for a temperature when evaluating the possibility of Ebola virus. And that parameter was a fever greater than or equal to 101.5. That has been dropped to a fever greater than or equal to 100.4. This recommended PPE has also changed. Goggles and face shields now reads as the goggle and face shield that fully covers the front and side of the face. All right, so again, just reviewing this is a little repetitive from the last training we did with you, but Ebola is a rare and deadly disease discovered in 1976 on the banks of the Ebola River in West Africa. How we get this is through direct contact with a patient who has Ebola and direct contact with their body fluids, such as saliva, mucus, vomit, feces, sweat, tears, semen, urine, or breast milk. Okay, so CDC says we get Ebola through direct contact. Well, direct contact must be defined, and per CDC, direct contact means that body fluids from an infected person, alive or dead, have touched someone's eyes, nose, mouth, or an open cut, wound, or abrasion. A few questions we want to ask. How long can Ebola survive outside the body? Ebola is killed very easily with hospital-grade disinfectants such as household bleach. Ebola on dried-on surfaces such as doorknobs and countertops can survive for several hours, and virus living inside body fluids such as blood can survive up to several days at room temperature. All right, so let's look at some signs and symptoms. Now, these are the ones that are occurring after about 8 to 10 days. Sudden fever, chills, muscle aches, nausea, vomiting, abdominal pain, and diarrhea. The initial signs and symptoms of Ebola are similar to many other more common diseases found in West Africa, other hemorrhagic fevers such as malaria and typhoid. All right, symptoms that may develop later with Ebola: chest pain, shortness of breath, headache, or confusion. Symptoms increasing in severity may include jaundice, unexplained bleeding or bruising, and other symptoms associated with Ebola. That fever parameter of greater than 100.4 degrees Fahrenheit, joint and muscle aches, weakness, lack of appetite, a rash, bumpy rash on face, neck, torso, and extremities without peeling, red eyes, hiccups, a cough with a sore throat, difficulty breathing, and difficulty swallowing. Okay, so let's talk again about these Ebola screening questions from Communications Center and you as a provider during your assessment. Of course, within 3 weeks, that 21-day mark is the indication that we need to stand by. Within 3 weeks or 21 days, has the patient had residence in or traveled to a country where an Ebola outbreak is occurring? West African nations such as Guinea, Liberia, and Sierra Leone. Within 3 weeks, contact with blood or body fluid of a patient known to have or suspected to have the Ebola virus. The next question is patient involvement with the handling of or preparation of dead human bodies known to have or suspected to have the Ebola virus, and direct handling of bats or non-human primates from disease endemic areas such as Guinea, Liberia, and Sierra Leone. Okay, so if the communications call taker or the dispatchers have information alerting them to a person with possible Ebola, they will make any first responder and EMS personnel aware confidentially of the potential of Ebola before the responders arrive on scene. The way that they do this is through the statement, precautions indicated due to amended EMD protocols. This statement has been agreed upon. the dispatcher will indicate the risk to you as the responder by that statement, and you will indicate to the ER staff prior to arrival by the same statement. Precautions indicated due to amended EMD protocol. So let's talk about high-risk incidents. An incident would be deemed as high risk if the patient has symptoms consistent with Ebola and has a positive risk factor as identified in the previous slide. So all of the symptoms we discussed, and they came from Sierra Leone after treating and going to the funeral of Ebola patients. Dispatch will dispatch the appropriate level of EMS units as identified by the CAD and additional units as directed by the SDO. If the patient's symptoms include vomiting, diarrhea, and/or bleeding, the response assignment will be upgraded to include a hazmat team and additional manpower such as an engine or utility to assist the primary responders at the emergency department, specifically for decon and helping them to doff their PPE. Incidents that are deemed high risk but are without the above symptoms will warrant the additional manpower such as engine or utility only. Okay, so the Communications Center will notify the SDO of high-risk incidents. Upon notification, SDO will report to the emergency department to assist the personnel. The SDO will communicate directly with communications, department chiefs, county officials, and the infection control officer. The SDO will communicate directly with and brief the Virginia Department of Health, and the Health District After Hours contact number is 1-866-531-3068. All right, so let's talk about some treatment considerations when treating Ebola. Of course, there is no cure for Ebola. We only treat symptoms, but some things you need to keep in mind to keep yourself safe as a provider. Limit the number of personnel accompanying the patient during transport. This is not one of those calls where we need 4 people in the back. Just 1 in the back and 1 driving is all we need in the transport vehicle. Ventilate the patient compartment during transport. Support unit shall follow transport unit to receiving facility to assist and provide immediate care to exposed EMS providers if needed. EMS will communicate with receiving facility on details of patient destination and transfer. Personnel will not enter the facility unless directed by the emergency department staff. Patient transfer in Fauquier Hospital will occur in the decontamination room outside the emergency department. All medical waste shall remain with the patient. If a high-risk patient refuses transport, immediately notify the area battalion chief and/or SDO. All right, so let's talk about the emergency medical response. We want to monitor the radio traffic for additional information and updates regarding the incident while we're en route. We want personnel shall don appropriate levels of PPE based on information available before entering the scene. Now, if we don't have that information, providers will assess the patient from a distance to determine the appropriate PPE based on the patient's condition. And responders should recognize that it will take several minutes to correctly don the necessary PPE, and we are in no rush. Okay, so let's talk about PPE and the choices we have. Well, first we need to decide what to wear. In the first days and initial phases of the Ebola virus, the patient has a low viral load, which typically exhibits flu-like symptoms. It's not an extreme exposure risk. In the later phases of the Ebola virus, like other hemorrhagic fevers, vomiting, diarrhea, and bleeding are common, and the exposure risk increases dramatically. So, patient assessment will dictate the appropriate PPE. Low viral load, patient's not vomiting, no diarrhea, no bleeding, that is a dry patient. However, high viral load, late in the virus, vomiting, diarrhea, and bleeding are common. That patient is a wet patient. So let's talk about a dry patient. Refers to the cooperative communicating patient with no bodily fluids present. Patient should be cared for with the medical Ebola virus PPE, which is the double glove, fluid impermeable gown, goggles, face shield, that covers the front and side of the face, the fit-tested N95 mask, and the shoe coverings. Okay, let's take a look at these. Double-gloved, fluid impermeable gown, goggles, the face shield or dental shield, the fit-tested N95, and the shoe coverings or booties. And here is a picture of the dry patient PPE. Just remember to tape around the gloves and gown at the wrists. This is just to ensure that there is no separation between glove and gown, exposing your skin. Okay, so now we're going to look at the wet patient or the Ebola patient that presents with body fluids, may be uncooperative, otherwise presents a significant exposure risk. It must be cared for with a higher level of hazmat, level C splash suit. These suits are carried on all EMS units. However, depending on crew size, additional units may be required to outfit all personnel. So let's look at the PPE for the wet patient. Of course, we're still double gloving. The level C splash suit, which is bloodborne pathogen approved. The dental shield or face shield. The N95 respirator and the goggles. And here's a picture of the wet patient PPE. And again, remember to tape between the level C splash suit and the gloves to ensure that there's no separation and exposed skin. Also, you can use medical tape to do this. All right, so dry patient, wet patient. If the patient has symptoms of Ebola and has a positive risk factor, the patient is deemed high risk. We decide whether or not they're dry or wet, and therefore we don our appropriate PPE. Responders shall limit the number of providers exposed to the patient and immediate environment. Limit invasive medical procedures. We talked about this in the last training, such as IV access, CPR, advanced airway management. That's per CDC. Consider, however, antiemetics administered IM to prevent vomiting and therefore lowering the exposure risk for you as the provider. Ventilate the patient compartment during transportation. All right, of course, we want to make that early notification to the receiving facility. Precautions indicated due to amended EMD protocols. Support unit's going to follow the transport unit to the receiving facility to assist and provide immediate care to any exposed EMS provider if needed. EMS will communicate with the receiving facility on details of patient destination and transfer. The personnel will not enter the facility unless directed by the emergency department staff. Patient transfer in Fauquier Hospital, again, will occur in the decontamination room outside the emergency department. All medical waste shall remain with the patient. And of course, if a high-risk patient refuses transport, we immediately notify the battalion chief and/or SD. Okay, so let's talk about donning procedures for PPE. We're first going to talk about the dry patient PPE. First thing we're going to do is inspect the PPE prior to donning. Visually inspect the PPE ensemble to be worn and ensure it is in serviceable condition. We're going to put on the inner glove. So the first pair of gloves go on. We put on the boot or shoe coverings, and then we're going to put on the gown. Ensure the gown is large enough to allow unrestricted freedom of movement. Ensure the cuffs of the inner gloves are tucked under the sleeves of the gown. Next is going to be the N95 respirator. We'll put on the N95 mask and then the goggles. And then we will put on the outer gloves. Put on the second pair of gloves with extended cuffs. Ensure the cuffs are pulled over the sleeves of the gown. Put on a face shield or the dental shield. The full face shield over the N95 respirator provides additional protection to the front and side of the face, including the skin and eyes. Okay, after we've placed everything on, we verify. After completing the donning process, the integrity of the ensemble is verified by your partner. You as a provider should be comfortable and be able to extend your arms, bend at the waist, and go through a range of motions to ensure there is sufficient range of movement while all areas of the body remain covered. Now, the last step in donning is to disinfect the outer gloves. We disinfect the outer gloves with an alcohol-based hand rub, allowed to dry prior to patient contact. Okay, so now we are going to talk about the proper donning of PPE for the wet Ebola patient. Of course, the first step in donning is to inspect the PPE. Ensure that the ensemble to be worn is in a serviceable condition. Next, we're going to put on that inner glove, put on the first pair of gloves, and then we're going to put on the N95 respirator. Next, now is going to be the Level C splash suit, or as it's called here, the coveralls. Ensure coverall is large enough to allow unrestricted freedom and movement. Ensure cuffs of the inner glove are tucked under the sleeves of the splash suit, and pull the hood of the splash suit over the hairline. Then we're going to put on our goggles. And then next is the outer glove, the second pair of gloves with extended cuffs, and we need to make sure that the cuffs are pulled over the sleeves of the coveralls. Next, we're going to put on the face shield or the dental shield over the N95 respirator and goggles, and this is going to provide additional protection to the front and sides of the face, including skin and eyes. Okay, so now we're going to verify. After completing the donning process, the integrity of the ensemble is verified by the trained observer, your partner. The healthcare workers should be comfortable and able to extend the arms, bend at the waist, and go through a range of motions to ensure there is sufficient range of movement, while all areas of the body remain covered. Okay, last step in donning of PPE for the wet Ebola patient is, again, to disinfect the outer gloves. We disinfect the outer gloves with an alcohol-based hand rub to allow them to dry prior to patient contact. Let's talk about doffing procedures now for our PPE. A quick note on the doffing procedures. The 2 nurses that have contracted the Ebola virus in the United States of America, CDC says that they did contract the virus during doffing of their PPE. So there's a huge focus on doffing of PPE in the CDC right now. All right, so for all patients, this is the removal procedure. Of course, you're probably going to be at the hospital at this time because once you put on your PPE, it will stay on until you are completely done with your patient transport and handover of that patient. They're going to have an engaged trained observer. The doffing process is conducted under the supervision of this trained observer who reads aloud each step of the procedure and confirms visually that the PPE is removed properly. Prior to doffing PPE, the trained observer must remind the healthcare worker to avoid reflexive action that may put them at risk, such as touching their face. First thing that's going to happen is the inspection. The PPE is inspected to assess for visual contamination, cuts, or tears before starting to remove. If any PPE is potentially contaminated, then disinfect using an EPA-registered disinfectant wipe. If the facility conditions permit and appropriate regulations are followed, an EPA-registered disinfectant spray can be used, particularly on contaminated areas. Okay, first we're going to disinfect the outer gloves. Outer gloves, hands with either a EPA-registered disinfectant wipe or a alcohol-based hand rub, and then we're going to allow them to dry. The provider is going to remove the booties or shoe coverings while sitting down. They're going to remove and discard the boot or shoe coverings. Next, they're going to disinfect the outer glove again using a alcohol-based hand rub. They remove and discard the outer gloves at this time, taking care not to contaminate the inner glove during removal process. Next, they're going to disinfect and inspect the inner glove. Inspect the inner glove and outer surface for visible contamination, cuts, or tears. If the inner glove is visibly soiled, cut, or torn, then disinfect the gloves with either an EPA-registered disinfectant wipe or an alcohol-based hand rub. Then remove the inner gloves, perform hand hygiene with the alcohol-based hand rub on bare hands, and don a clean pair of gloves. Remember, you still have PPE on that is contaminated. You must put gloves back on if those inner gloves are cut or torn. If no visible contamination, cuts, or tears are identified on the inner glove, then disinfect the inner gloved hands with either an EPA-registered disinfectant wipe or an alcohol-based hand rub. Okay, the next thing we're going to remove is the face shield. Remove the full face shield by tilting the head slightly forward, grabbing the rear strap, and pulling it over the head, gently allowing the face shield to fall forward We discard this face shield and, of course, avoid touching the front surface of the face shield. Next, again, disinfect the inner gloves using that alcohol-based hand rub. Now we're going to remove the gown or coveralls, depending on whether this is a dry or wet patient. We're going to remove those and discard. Now, depending on gown design and location of fasteners, the healthcare worker can either untie the fasteners, receive assistance by a trained observer to unfasten the gown, or gently break the fasteners. Avoid contact of scrubs or your duty uniform or disposable garments with outer surface of gown during removal. So we want to pull the gown away from the body, rolling it inside out and touching only the inside of the gown. Okay, to remove the coveralls or the level C splash suit, you're going to tilt your head back, reach under the face shield to find the zipper or fastener. You can use a mirror to help avoid touching the skin. Unzip or unfasten the level C splash suit completely before rolling down and turning inside out just like the gown. Avoid contact of scrubs or your duty uniform with other surfaces of the coveralls during removal, touching only the inside of the level C splash suit or coveralls. Okay, so now that we've done that, we've removed the level C splash suit or the coveralls. We're going to disinfect and change the inner gloves. So, using that alcohol-based hand rub, we're going to remove and discard the gloves, taking care not to contaminate the bare hands during removal process. You're going to perform hand hygiene with the alcohol-based hand rub on the bare hands and then don a new pair of inner gloves. Now we're going to remove the N95 respirator. And to remove this, you're going to tilt your head slightly forward, grasping first the bottom elastic strap and then the top elastic strap and removing without touching the front of the N95 respirator. And of course, we will discard. Okay, now we're going to remove the goggles. Remove the goggles by tilting the head slightly forward, grasping the strap at the back of the head, and removing without touching the front of the goggles. Discard. We disinfect and remove the inner gloves at this point. Disinfect the inner gloves with either the EPA registered disinfectant wipe or the alcohol-based hand rub. Remove and discard gloves, taking care not to contaminate bare hands during removal process. Now you're able to perform hand hygiene on the bare hands with the alcohol-based hand rub. All right, so we do a final inspection of the healthcare worker for any indication of contamination of the clothing or skin. If contamination is identified, immediately inform infection preventionist or occupational safety and health coordinator or their designee before exiting PPE removal area. Of course, showers are only recommended at the end of each shift for healthcare workers that are performing a high-risk patient care sort of things. That means they're exposed to large quantities of blood, body fluids. Showers are also suggested for healthcare workers spending extended periods of time with confirmed Ebola patients. Okay, so now we're going to talk about decontamination post-incident for the provider. All right, so the SDO will meet personnel at the emergency department and will communicate with personnel via the ECC and or cell phone while he or she is en route. SDO will oversee decontamination process and will assign resources accordingly. Now, unless otherwise directed by the SDO, decon procedures shall not be initiated until his or her arrival. Personnel will properly doff and red bag PPE, just as we just talked about, and dispose as directed by the SDO or hazmat team, depending on the situation. The infection control officer, in conjunction with the staff duty officer and or hazmat officer, will conduct a risk assessment of the decon procedures. The unit decontamination will not begin until direction is given following the risk assessment. And providers shall maintain use of PPE during decon procedures. Additional protection may be required for grossly contaminated equipment or apparatus. Okay, so let's talk about exposure and exposure reporting. This is just a review of the previous training. Nothing has changed here. Personnel with exposure to blood, body fluids, secretions, or excretions, either percutaneous or mucosal, should first stop working and immediately wash the affected skin surfaces with soap and water. Mucous membranes need to be irrigated with copious amounts of water or eye wash solution. They need to immediately notify their supervisor and or SDO, who will communicate directly with infection control officer through the SDO assessment and access to post-exposure management. Determination of return to work will be based on EMS agency policy and discussions with local, state, and federal public health authorities. Okay, so exposure and exposure reporting continued. Personnel who develop sudden onset of fever, intense weakness, or muscle pain, vomiting, and diarrhea, or any signs of hemorrhage. Of course, this is after an exposure to an Ebola patient. Do not report to work, and if you are working, immediately stop working. You should not be working because you're going to be isolated if the patient was positive. Isolate yourself from contact with others. If medical attention is necessary, notify the medical providers, facility, and advise of the potential exposure prior to contact with medical personnel. Immediately notify your supervisor, who will communicate directly through the infection control officer. Okay, so let's just look at some logistical considerations for our PPE. The PPE kits containing the impermeable gowns, the surgical masks, the gloves, the biohazard bags, and the booties. We have an initial order of 200 kits. We're deploying 5 per ambulance. The eye protection goggles, we have an initial order of 144, deploying 5 per ambulance. The face shields, the dental shields, the full face shields, initial order of 192, deploying 5 per unit. The N95 masks, both dome style and flat in storage, 500 dome masks, initial order of 500 additional dome masks, and 200 flat masks. We're deploying 10 dome masks and 5 flat masks per ambulance. Of course, with the N95s, we must do fit testing. That's an OSHA requirement. Initial order of 3 kits, each perform 100 tests. Logistics personnel have made fit testing available to all personnel. The Level C splash suits that are bloodborne pathogen approved for use with the wet Ebola patients. Initial order of 96 extra large suits. Quantity and sizes are limited, and we are deploying 3 suits per unit. Okay, thank you. This concludes the Ebola response plan training and PPE training for Fauquier County. Of course, now this is an ever-changing situation. It's constantly changing. We're constantly getting new updates from CDC and Health and Human Services. And we will keep you updated to any changes. Thank you. Have a good day.